Hi, this is Kevin, and I'm here at the ASCO meeting in Chicago with a Cure Insight. And I'm also here too with Catherine Alsina from Castle Bioscience. And today I'd like to ask her a couple questions about a poster that Castle is presenting here during the ASCO meeting today. And it gives us an update on the data that resides in their database for their gene expression profile panel and also their further deeper genomic testing of patients who have agreed to send samples to Castle of their uveal melanoma tumor. And so I have a couple questions for you today, Kat. So I think this is a pretty important study that you're presenting from Castle Biosciences. And I think in general, it looks back at about 3,267 uveal melanoma tumors submitted from patient biopsies that were taken between February 2018 and December 2023 for clinical testing. The major objective I saw in the abstract was to examine associations between the critical Castle UM15 gene expression panel and the two additional tests Castle provides for PRAME and DNA mutations. So could you please explain the findings from this study?
Yes, thank you, Kevin. So, as you mentioned, Castle offers three tests for uveal melanoma patients. The DecisionDx test is the gene expression profile test that gives a low risk class 1 or high risk class 2 result. And that test has been shown to be the most accurate in terms of predicting patient outcomes. But we do now offer additional testing for PRAME and for certain gene mutations that can both be done alongside the 15 GEP test. And those additional tests can help provide more refined information about a patient's unique tumor biology. And so, because those two tests are a little newer than the GEP, and now that we have several years of clinical testing data using all three tests together, we were able to do some interesting cross comparisons in, as you mentioned, a large cohort of over 3,000 clinically tested patients who had all three tests performed from their initial biopsy sample. So all of that information can be obtained from a single biopsy. Most of the time, those are fine needle aspirate biopsies, so they're very limited in terms of the amount of tissue that we have to work with. And one key takeaway that I think is relevant for patients is that the technical success rate for delivering results was very high, in the range of 97%. So 97% of the time, we're able to successfully deliver actionable results to patients and to their doctors, even from this very small tumor sample. And I think these results are really important because they're used to guide how often to screen patients for metastatic disease. And they may help determine whether patients are candidates for certain clinical trials and treatments as they become available.
Thanks. And I was wondering too if you could discuss the associations that you mentioned across the different test results and the main conclusions from the study in terms of the impact for ocular melanoma patients who receive a gene expression panel class 1 or a class 2 risk result.
Yes. So another goal of the study was to look at how the GEP classes relate to the PRAME status and to the DNA mutation status. And PRAME positivity, we know, is associated with more aggressive tumors, and mutations in genes like BAP1 and to a lesser extent SF3B1 have also been associated with more aggressive tumors. So the question was, how do these other biomarkers kind of line up with what we know to be the most validated and the most accurate result, which is the GEP class result? And the key takeaway with the study is that not all of the class 2 tumors will be PRAME positive, nor will all of them have detectable mutations in BAP1. So there's something that the GEP class is telling us about tumor biology that PRAME and mutation data alone are not telling us. And then the same was true for the class 1 tumors. And in terms of the impact to patients, we believe that the PRAME and the mutation data are important as supplemental information, but should not be interpreted independently of the GEP class result. Now, while this study did not include patient outcomes data, there is a large multi-center study called the COOG-2 study that does include outcomes, and it's currently in the process of being published. We're very excited about that. And this study will provide more insight into how to best interpret these supplemental biomarkers, particularly the PRAME status, in the context of the GEP class result, to help better refine patients' individual metastatic risk level.
Well, thanks, Kat. That's really interesting information. And in closing, if there are patients and families who are interested in molecular testing of their uveal melanoma, either in an upcoming or even a prior biopsy, they should discuss the Castle Decision DX tests with their surgical ocular oncologist or maybe even their medical oncologist. So, on behalf of all the patients living through uveal melanoma, thanks very much to Castle Biosciences and your investigators for this valuable information in our rare disease. So, now on a personal note, in June 2019, right in this very hall at ASCO, I met Melody and Lauren from a Cure Insight just 3 weeks before my biopsy. They realized that my doctors in Philadelphia did not inform me of this molecular testing. And so I met with the experts from Castle right here at ASCO and took the forms back to my doctor for our signatures before my biopsy surgery. My results were actually included in the study we just discussed. And so now, at 5 years post diagnosis and plaque radiation therapy, my very favorable molecular results match with my continuing metastasis free survival. So I am very grateful to Dr. Harbour and his colleagues and Castle Biosciences for this remarkable and important gift of science.